Welcome to Weekend Magazine, the program where we examine the people, issues, and events that impact New England. I'm Ann Callahan. You feel edgy? Your heart may be starting to race a bit? Sweaty palms? Fear? Let's face it, no one looks forward to visiting the doctor's office. To say it may be a bit unsettling would be an understatement for some people, but it doesn't have to be that way. Dr. Ken Redcross, author of Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor, has some reassuring things to say that should make most of us less apprehensive about a visit to the doctor, as he explains here to Weekend Magazine's Randy Berkson.
Thanks for joining us, Doctor. It's a pleasure to have you with us.
Oh, thanks for having me on this weekend, Randy. I'm very excited, so it's good to be here with you today. And hello, everyone out there.
All right, you bet. So why is a lasting and caring relationship with your doctor important? How do you establish it, first of all?
Look, guys, so the important thing, especially now as we're dealing with the pandemic, and, it was interesting, Randy, there was a study that showed up to 40% of us did not seek medical care, obviously, during the pandemic. So it's even more important now that you have a very good, special, and open relationship with your doctor, not only just for happiness, but also for good health outcomes and those things that are so important when you have a good relationship with your doctor each and every day.
Dr. Redcross, why is it important? In other words, the appointments that people get are usually pretty quick, like 15 minutes. So how do you establish a relationship when appointments are averaging 15, maybe 20 minutes?
Well, gosh, Randy, you're being generous. Actually, guys, when you get your appointment slot, the slot is for 15 minutes, but the data shows you really get about 7.5 minutes of the doctor's time. And so that's the big issue. So one of the things I want everyone out there listening to remember, if you're going to go to your doctor's appointment and it's that 15 minutes, quote, end quote, make sure that you make it a high yield appointment. So I tell patients to do 3 things, Randy. Number one, before you go in, make a list. It's so easy to forget what you're going in for, especially when you've made that appointment a month or two ago and you kind of forget exactly what was bugging you. So you want to make sure you make that list because you want to strategize before you come into the doctor's office. The second thing I say, Randy, is when you get to the appointment, repeat the information over and over to make sure that you understand exactly what the doctor is saying. They had another study, which was fascinating because they showed that when patients actually leave, they forget 80% of everything the doctor said. And the part they do remember, Randy, tends to be wrong, at least half of it. And then the third thing I want you guys to do when you're going into your appointment, you make that list, number one, you repeat the information. And the third thing, ask questions. Ask questions is important because when you're repeating yourself, it helps with retention. So when you're getting there to that appointment and you know it's a little bit of a short appointment, let's make sure there's some value to it. So kind of go in with a plan or a strategy before you walk through the door.
The strategy session that you have with yourself that you're describing, Doctor, I think is very helpful or could be very helpful in dealing with white coat syndrome. For those who don't know, what is white coat syndrome?
Yeah. So white coat hypertension, we call it, guys. This thing, when you go in your doctor's office, sometimes you're a little nervous. You don't know what to expect, and your blood pressure can go up a bit. And you want to make sure that if your doctor notices that your blood pressure is a little elevated, they'll obviously be attuned to it. But sometimes that can just be a little bit of nervousness and anxiety. So that's why I always tell patients it's important that you have a blood pressure cuff at home so that you can measure your own blood pressure when you're nice and relaxed in your own surroundings and share that with your doctor. So white coat hypertension is very, very real. But once again, the best way to combat that is to have your own blood pressure cuff at home as well so you can kind of report back to the doctor.
What are some of the difficult discussions that you might have to deal with as a doctor to a patient?
Oh gosh, the pandemic, guys, has really made 3 big ones that I've been having and a lot of my colleagues. One of the bigger things that we've all heard about are the importance of supplementation, right? And when we're learning about vitamin D. And the reason why I mentioned vitamin D here, Randy, is that, vitamin D was always a story about bone health when we were kids growing up. But we learned through the pandemic that vitamin D is incredibly important to help balance our immune system. But it doesn't matter if you don't get your levels checked. And when you get your levels checked, Randy, we talked a lot about them being between the levels of 40 and 60, getting them checked at your doctor's office, or there's some pretty cool, innovative websites like thepowerofd.org where you can order your at-home test kit on your own and kind of check it. but it's that important. And so the supplement discussion with patients has been a little tough because some docs aren't necessarily open to alternative ways of helping and supplementing wellness. And so that's something that a lot of patients are a little bashful about. But when it comes to vitamin D, that's something that none of us should be bashful about a discussion in the future. The second tough discussion, and this probably won't surprise you, Randy, are about the vaccines, whether it's a vaccine or not. One of the things I talk to patients about all around the U.S. is go into your doctor and have that discussion and say, hey, doc, what are the pros and cons of me taking the vaccination? Because everyone isn't created equal. And I think that's where the problem has been that we're seeing here in the States, where some are anti-vaccine, some are pro-vaccine. I think you really have to have a specific discussion with the patient. My discussion with an 85-year-old who has heart disease, COPD, emphysema, and all these other challenges is very different than a discussion with a 17-year-old healthy patient, right? So it's important that you ask the doctor, why me? Why do you think it's best for me? And last but not least, this pandemic has also shown an ugly light on some of the challenges with substance abuse and poor diets and poor habits that we've adopted because we feel isolated. We're stressed out. We feel like, when is this going to be over? I want to get back to normal life. And so that coming clean discussion is that other difficult discussion that I know is hard to have with your doctor. But Randy, if you have that relationship with your doctor that I think each and every one of you out there listening should have, it should be a little bit easier to kind of say, hey, doc, there's something that I need to talk to you about.
How do you handle a difficult patient who may not want to take your recommendation or advice, say in the case of surgery or some other procedure?
Look, that gets back to the kind of four cornerstones that I talk about in the book. And the reason why I talk about these cornerstones, Randy, is because I find that when all four of these are aligned, you have a wonderful relationship between the doctor and the patient that's fulfilling for both. So when you have trust, respect, empathy, and communication that's going both ways, you usually don't have those challenges, Randy, as far as the patient saying, well, I don't want to do this. I don't want to take your recommendation, because we have that communication piece that I've already shared, why I think it's a good idea. And if you don't think it's a good idea, what do you think? What should we do? And then there's that trust that they know that, hey, I'm in it for them. And that goes back to empathy as well, saying, look, I feel what you're going through. Don't think I'm just kind of willy-nilly writing this prescription and forgetting about everything. That's not the way that it really is. And so when you kind of put all four of those together, Randy, it makes it a little bit easier to kind of navigate your day, because, the patient should feel like a member of your family, but they should also feel like a partner in their care. So I think when you involve them, you have a lot less cases of those things popping up.
You're listening to Weekend Magazine, and our featured guest is Dr. Ken Redcross, author of Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. Dr. Redcross is pointing out to Weekend Magazine's Randy Berkson things we can do to make us feel less apprehensive and more comfortable when we visit the doctor's office.
How do you, as a physician, impact the community in which you serve?
Oh gosh, how long do you have, Randy? Now you're barking on my passion. So I am a concierge physician, everyone. And so it's a little different, right? It's just like a concierge at a hotel where you go there and they tell you where you should eat and the best recommendations. And that's what I do. And I make house calls. That's the bigger part of my practice. So I'm in patients' homes, or I'm taking calls around the United States to provide advice for patients who are far and having challenges with the patient-doctor relationship. So I'm able to impact the community in different ways, whether it's some of my entertainers and well-known folks, or whether it's just some of the young ladies I take care of here at the cafeteria where my kids go to school. But it allows me to once again get into the soul of the patient. And that's what all of this is about. That's why I want everyone to leave here hoping to say, Dr. Redcross is right. I should have a good relationship with my doctor. Or if I do have a good relationship, thank God, that's the way it should be. And so, that's kind of, like I said, my passion going forward is that everybody leaves with that information at least.
I have to back up a little. You mentioned you make house calls.
I do.
And I had to pinch myself when you said that, doctor, because frankly, I don't think I've had a house call from a doctor since I was about 10 years old, and that was about 100 years ago when Robert Taft may have been president at the time. Anyway.
He's an interesting president. That's okay.
Well, you're an interesting doctor. Can you explain how it is that you're able to make house calls in this day and age, especially with what's going on out there.
Yeah, guys, and that's the challenge, right? Throughout the pandemic, at the beginning, about a year and a half ago now, look, I'm in the homes of patients who are deciding that they want their lives to lead there in the home. They don't want to go to the hospital and not see their loved one. So, making a house call is a very special connection. Even though I'm here in New York, I do three things. So New York and the Westchester area and that sort of part in Jersey and Connecticut, I can go to the homes. When patients I have, one that was in Germany, another one that was in Canada, that's a little bit more of a consultative thing there, Randy, where they'll have their doctor, they have their setup, but they have me in order to kind of go through the labs, go through what they should ask their doctor next. Whether they want to discuss what their doctors discuss with them so that we can have a plan and a strategy for them. So it allows me to kind of reach out different ways. If I can't make that house call in person, I try to make that house call through the phone and through video for someone far away.
How do you handle a difficult case, doctor? In other words, maybe you can cite an example or tell a story of a case that was difficult and how you were able to resolve it.
I could probably think of a ton of cases that are very challenging, but when I think about some of the cases, I mentioned this in my book. I mentioned like kind of behind the curtain, and behind the curtain is meaning like when you come into the doctor's office, it's very private, and you have a curtain where you kind of come in, and behind there's just a lot of things that come through. And so I remember that there was a discussion that I had with a patient that was having some great difficulty as far as just coping. She was older. She was she was almost a little over 100 years old. And she had been talking about never really being addressed as far as the stress and so forth that she had had into her life. And so she talked about how difficult it was. She had lived in kind of the Eastern Bloc nations and so forth some years ago. And so after a while, and I'm examining her and we're talking more about her stress, she talks about her being in a concentration camp in the past. And I saw the number tattooed on her wrist. And look, this was something that I'll never forget, because I started just to realize like the importance of being able to close that curtain, and for her to be able to divulge this to me after years of just holding on to this on her own. And so, that's one that always comes to me. I mentioned that in the book because it was powerful that she entrusted that to me, of all people, this doctor who just got her. And so those are those special connections that I live for, that I think all of you should be able to have a discussion with your doctor and hopefully feel as close to them as she did to me. And so those cases are difficult, of course, to where I try to reach out. I reached out to the Jewish community to try to figure out what sort of things do they have for members. And of course, there were tons, but I was happy to be a part of that. And so those are those difficult things that are just very difficult emotionally sometimes as well, Randy. But that's why I was put on this earth to be able to participate in those sort of issues and challenges.
While you're on the subject of ethnicity, doctor, do you have a demographic, a general demographic of the patients that you see, who they are, where they're from?
So I'm in the Northeast, everyone. But as I mentioned, I have patients really all around the world with the concierge way that I set it up. Even still in Los Angeles, where I used to practice as well. My particular ethnic base is fascinating in that it's pretty diverse. Whether I take care of a group out of the synagogue, or whether it be a large portion of African-American patients, Latino patients, because I used to work in El Yunque in Puerto Rico, so I'm proficient in Spanish. So I have a very diverse, and whether it be my group that's in Beverly Hills as well that I took care of. So I'm fortunate enough to have a diverse population in that case, and even around ages. It's interesting. I'd probably say maybe mid-demographic 50, even though I kind of have a little young population of entertainers who think it's pretty cool to have a doctor that understands them and understands some of their challenges as well. So I'm very blessed, that's for sure.
It sounds like you enjoy your work and you enjoy the people that you're serving.
Oh, absolutely. Randy, I always joke around. I don't know what the heck I'd do if I was a doctor. I would just walk around aimlessly. Like, what do I do next? I don't know what I would do, but at least I know what I was born to do now. And I haven't had to make those decisions or walk around aimlessly figuring out what to do with myself. As an only child, I'll just talk everybody to death, Randy. That's probably it.
Well, we are talking. There's no question about that. Winding up, how do people get hold of you, and where can they go?
Oh, sure. So everyone, my name once again is Dr. Ken Redcross. Yes, just like the American Red Cross. You can reach me on any of the social media platforms, whether it be LinkedIn and Twitter and Facebook and Instagram. And by all means, and this isn't lip service. Reach out, say hello, ask questions. I'd love to figure out how I can help support you or do whatever I can to put a smile on your face.
And the name of the book that you've written that we're talking about?
Oh, it's called Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor.
And that's available online, presumably?
Oh, yeah, it's available on Amazon. I'm very proud to say it was number one in the category, fascinatingly enough, in the category of medicine and psychology when I put it out. So it's available on Amazon and so forth. And once again, look, it was a labor of love, and hopefully if anyone picks it up and they like it, reach out and say hello.
Again, that was Dr. Ken Redcross, author of Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. Dr. Redcross was speaking there with Weekend Magazine's Randy Berkson about the things we can do to make us feel less apprehensive and more comfortable when we visit the doctor's office. I'm Ann Callahan. Commentary from the Colson Cultural Center, mission reports from around the world, and focus on the family's look at what's worth seeing this weekend are straight ahead here on Weekend Magazine.